Good afternoon, everyone. Welcome to our webinar on Pharma Code Update and its implications. I'm very, very excited to be hosting Seth and Brian on our conversation today. I don't think they require any introduction. King & Spalding is a well-known name in life sciences, and Seth and Brian are partners at King & Spalding, and they will provide a quick introduction about themselves as we go through. My name is Mohammed Uwais. I'm founder and CEO at Core Data. We provide compliance solutions for the life sciences industry. This is pretty much going to be my only part in the webinar. I'm going to hand it over to Seth and Brian to cover Pharma Code and its implications, so that we can get most value in this 1 hour. This webinar has had record number of registrations, so we're hoping this is going to be extremely valuable for the industry. So with that, I'm going to hand it over to Brian and let him take us through the update and its implications. So Brian, over to you.
Great. So as Brian is pulling up our presentation, hopefully you'll be able to follow along with the slides as we discuss this afternoon. I'm Seth Lundy, and I'm the Deputy Chair of King & Spalding's FDA Life Sciences practice based in Washington, D.C. And Brian and I have been spending a lot of time with various clients and companies talking about the latest now iteration of the Pharma Code, and we thought this would be a unique opportunity to talk with you, give you a chance to ask questions, and sort of walk through a little bit, I guess, of the iterations of the Pharma Code as it first began in 2002 through to the latest changes that we have, and then look at those changes in the context of the OIG Special Fraud Alert on speaker programs, talk specifically about the changes that are most impactful with the latest iteration of the Pharma Code, again, that will go into effect January of 2022, focusing on some of the key differences and most importantly, the implications for the differences between the Special Fraud Alert and the Pharma Code guidance itself, and hopefully leave you with some important takeaways and ideas of next steps to take at your company. Brian, do you want to introduce yourself before we move forward too?
Yeah, thank you, Seth, and thanks, Mohammed and the Core Data team for hosting us today. We're happy to be here. I'm Brian Bonenkamp. I am a partner in the DC office of King & Spalding. I do a lot of compliance, general compliance, fraud and abuse work and counseling for pharmaceutical medical device companies. And as Seth said, you know, since the code was updated, since frankly the fraud alert came out last November, and really since even the Novartis CIA came out last June, we've been having discussions with manufacturers around these kinds of issues, especially around speaker programs. So we are excited to kind of talk to you today about this. We're hoping that you get kind of food for thought as you're thinking about how you're going to tweak your policies and procedures and get a sense of what the risk might be to your company vis-a-vis this stuff. So thank you, and we hope you find it useful today.
Great. So let's open up, let's start the presentation and open up our first polling question, which is, does your company state that it voluntarily adheres to the Pharma Code, whether or not you're a pharma member, but are you publicly indicating that you are voluntarily adhering to the Pharma Code? Give everyone a second to.
Yep, we should be, audience should be able to see the polling on their screen. Okay, we'll give maybe another 10 seconds or so. Looks like folks are still voting in. Okay, I'm going to close the poll, and you should be able to see the responses.
Right. So not surprisingly, again, most of you are suggesting that you are publicly stating that you are voluntarily adhering to the Pharma Code. And we'll talk a little bit more about why that's likely the case in terms of there are several states that are asking that companies make that certification in order to be able to comply with state law. And certainly for those of you that indicated that you comply with the AdvaMed code instead, that is an alternative under the state laws as well. And so that becomes an implication for really now the growing importance of the PhRMA code and the AdvaMed code as well, as a parallel for the medtech industry. And so looking at the next slide, where we wanted to just sort of start off this conversation was with just some basic points about looking at the history of the PhRMA code itself, which dates myself a little bit, because quite frankly, when I started practicing law over 25 years ago, there was no PhRMA code 25 years ago. And I bet that all of your companies really took a position that the types of laws that we engage with today as part of a corporate compliance program, being the Federal Anti-Kickback Statute and the False Claims Act, at this time in the early and mid 90s, most manufacturers took the position that those laws simply did not apply to them unless they had a division that was directly billing to federal healthcare programs. And so as we move to the next slide, what really started to happen is the first key iteration was actually HIPAA, which was passed in 1996. And I remember as a young associate looking at the HIPAA Act and not focusing so much on what it's known for today, its privacy provisions, but looking specifically at the fraud and abuse provisions that were included in that law, and starting to examine how they were likely to be applied beyond the hospitals, doctors, and health systems to which they had historically only been applied, and looking at how the Department of Justice and the Office of Inspector General were likely to use them to go after activities of pharmaceutical and medical device manufacturers. And lo and behold, what ended up happening is just 2 years after HIPAA was passed, several investigations started in and about the time frame of 1998, ultimately culminating in a settlement in 2001 with TAP Pharmaceuticals regarding an AIDS wasting drug, which is generally understood as the first false claims act of its kind against a pharmaceutical manufacturer. And this sent shockwaves, although folks like me had been out talking about it for a couple of years, knowing that investigations were going on, having read HIPAA and talking to manufacturers. The question Brian and I always get when we try to lead the way in that regard is, yeah, but who's actually gotten in trouble? What has anyone actually done about it? And the TAP settlement was a real shot across the bow, signaling that the Department of Justice was serious about enforcing the Anti-Kickback Statute and the False Claims Act with respect to manufacturers of products that may be covered by federal healthcare programs. And the biggest problem with this immediately was recognized in the industry that, hey, these laws weren't written with pharmaceutical and medical device manufacturers in mind, and the protections afforded under the exceptions to the Anti-Kickback Statute and the safe harbor provisions really didn't consider the types of business operations that manufacturers undertake even today, as those provisions still haven't really been updated over the last 20 years. And so what PhRMA started to do was to undertake a mission to be able to set a framework under the Anti-Kickback Statute to say that there are certain activities that the industry engages in which are normal business practices that may involve remuneration being provided to potential referral sources for the company's drugs or devices. But while they wouldn't meet a safe harbor to the Anti-Kickback Statute, shouldn't be considered to be an illegal inducement that would ultimately violate the Anti-Kickback Statute. And that really sort of brought about the birth of the PhRMA Code in its first iteration in 2002. It wasn't intended to be law, but it was intended to address the potential risks that manufacturers faced under particularly the Anti-Kickback Statute. And to help do that, a committee at PhRMA of many of your companies and PhRMA itself had various meetings to put together the code to look at what we were doing as an industry and how those activities could be justified in the face of the anti-kickback statute. PhRMA went a step further after coming out with its code, which is before the code was ever even announced, it was shared with the Office of Inspector General for review by OIG and comment. And OIG generally did not respond with any unfavorable comments to the code. And therefore, when it was implemented, it was understood, well, again, not to have the force of law, but to have the understanding that government regulators were in accord generally with what the code was saying. And in the years that followed, on the next slide, the AdvaMed code started to become a baseline for what OIG and DOJ looked for towards compliance for the industry. Even though during this period between 2002 and 2009, if we had asked that initial polling question about how many companies were voluntarily complying with the code, I think we would have been down much closer to the 50% mark at that juncture. But during this period leading up to 2009, one of the things that we began to see are, beyond the TAP Pharmaceuticals settlement, there were a number of other investigations resulting in settlements and large civil fines against manufacturers that led, again, PhRMA to retool the code and recognize that statements needed to be refined as a way to be a better prophylactic source to protect manufacturers from these types of applications of the anti-kickback statute, and to potentially deter whistleblowers from blowing the whistle on activities that are mundane and commonplace for manufacturers and that were believed to not implicate the anti-kickback statute. The next
I would also
slide.
just add quickly, sorry, just to add something really quick. I think that if you look at kind of the evolution of the code and when it's been changed as we go through this, it's also, I think, used in part as an advocacy tool, right? Because what happens if you look at 2009-ish, you had a lot of states coming online with their gift bans, like Vermont, Massachusetts, et cetera. And so it becomes a response to be able to show regulators and policymakers we can self-regulate. So when you look to, and not to get ahead of ourselves, right, but when you look to what we're going to talk more about today, of course, the seismic event that happened was a fraud alert, and then thinking about it from the standpoint of advocacy, because the last thing we want is more states to come online and regulate speaker programs, for example. Sorry, Seth.
No, that's right, Brian, and those are great points. And really, that's what continued to happen until the third iteration of the PhRMA code in 2019, where there really wasn't any seminal type of event that precipitated the code, except that it had been almost 10 years since the prior iteration of the code had been released. And as Brian indicated, the real goal here, again, was to keep up with the times, to keep up with the latest trends, to look at what was out there, and to expand and provide additional guidance to the industry, both for purposes of helping to set a level playing field for the industry, but also to be a thought leader as a trade association and as an industry to get out in front of some of these issues that were potentially percolating in terms of both investigations and state actions and legislation. But the last iteration that we're going to spend the rest of today talking about, the newest PhRMA code revision, is really precipitated specifically by a single document and case. Brian mentioned the Novartis case that led to last year's OIG special fraud alert on speaker programs. And this was notable to Brian and I immediately for a number of different reasons. First, there was already guidance available to the industry coming out of the Novartis settlement, where there was a significant settlement agreement, a corporate integrity agreement, and a substantial amount of press with regard to the speaker programs that Novartis was alleged to be undertaking. And that in and of itself provides a fair amount of guidance for us in the industry in terms of things that the Department of Justice and OIG are concerned about with regard to speaker programs specifically. But the settlement clearly only applied to Novartis, and there were certain facts that were alleged in that case that are likely to be viewed by industry as being out of the norm and more egregious. There were also activities that took place quite some time ago, as is typically the case with regard to settlements. We're looking at facts and circumstances that take place sometimes as many as 5 or 10 years before we actually see the settlement. And OIG, though, took it upon itself to follow that settlement with its own guidance. OIG hadn't issued guidance like this in 6 years. And the OIG guidance, we'll talk more about it specifically in a moment as Brian will lead us through. But the first thing that struck me is this was the first time that we had seen guidance come out of a federal agency that actually had points in it that were not consistent with the PhRMA code as it was then in effect. And that, going back to my statement back to 2002, when OIG reviewed and generally condoned the initial PhRMA code iteration, as well as subsequent iterations of the PhRMA code, that put us as industry in a unique and different situation where for the first time, a federal agency, and specifically OIG, was taking a point of disagreement with statements in the PhRMA code and suggesting that they may be more egregious even if a company actually followed the provisions of the code. So Brian, let's walk through a little bit of the speaker program fraud alert itself.
Yeah, sure. And actually, you know, the history that Seth just provided in terms of like the origins of this, right, with the Novartis settlement from June 2020, and the other examples that I think most of us are aware of recent settlement and frankly historical settlements around speaker programs. The reason it's important to keep all that stuff in context, right, is when you look at the fraud alert itself, as Seth said, I mean, from OIG's perspective, they are typically reviewing the most egregious sets of facts and circumstances, which then ultimately cause them to react in ways like, for example, issuing the fraud alert. And so the context in which OIG comes to the table here is through that lens, because I think a lot of folks, when the fraud alert came out, in industry and us included, you're kind of scratching your head around why is this even needed, you know, because most industry players, most companies are not going to be engaging in any type of activity, especially in today's compliance environment, along the lines of what the allegations were in some of these settlements. And so the reason that's important to understand is that when you look at where PhRMA has gone with the updated code, and we'll talk more about this, but there are still remaining discrepancies between what OIG has identified in the fraud alert as potentially suspect characteristics and where PhRMA landed, right? And so when you're assessing your risk, for example, the concept of alcohol, right? And I'm just going to talk generally. I don't want to spend too much time on the fraud alert because I know many of you have probably read the fraud alert 50 times. You've probably seen 50 client alerts on it, so we don't need to rehash it. But it's important just to have the discussion in the context of the PhRMA code revision, which is why we're talking about it, right? But as an example, with alcohol, right, the fraud alert, and alcohol is probably the one thing that everyone's been talking about in great lengths and kind of hand-wringing about with their speaker programs when you talk about the update to the PhRMA code. But the fraud alert mentions that the availability of alcohol is itself a suspect characteristic, right? And so if you're thinking about, you know, the PhRMA code in some respects maybe not having gone as far as the fraud alert and what that delta means, that's where everything else becomes so important, right? Which is, what is your underlying policy, procedure, process for ensuring a legitimate compliant speakers bureau? Because in the end, I think what you really want to not lose sight of is this should be about kind of putting in place a compliant speakers bureau with respect to speaker programs, that if you ever had to defend it, you could confidently defend it, including, for example, maybe somebody can buy a beer when they're there. That in and of itself should not create a substantial risk if everything else is on the rails. But again, you put this in the context of the facts at issue in some of these settlements where alcohol is flowing, it's high dollar alcohol, it's clearly painting a picture of these are not appropriate educational events. So it makes total sense that OIG would put a suspect characteristic to be the presence of alcohol. But it doesn't necessarily mean that in every case, the availability of alcohol is going to be a high risk scenario, right? And so the larger point is just keep that delta in mind as we walk through this. And I'm just going to highlight some of the key things, right? One is alcohol. We'll talk about that as we go through the presentation, of course. The other one on this slide is the location and venue. OIG in the fraud alert specifically mentions in an example the idea of restaurants being potentially a suspect characteristic. And so that's another one that people are wrestling with, and we'll talk about that more when we talk about the revisions to the PhRMA code going through that point. Now, looking at this slide, slide 13, most of this stuff, I would say, is stuff that most companies have already in place in some form or fashion with respect to their speaker program policies, right? So limits on the number of times an attendee can actually receive or attend a speaker program, especially if there's been no new information or no indication. Of course, limits on not permitting friends, family, significant others, etc. A lot of this stuff, again, many things in the fraud alert, which are kind of predicated on these egregious cases, are things that most of us that have been in compliance for a long time are just like, well, okay, I get it. Like that's been in our policies forever now. Another one that I think touches a lot of people and makes them scratch their heads in terms of how you navigate it is number 8 on this slide in the fraud alert, which is they suggest that there is a suspect characteristic if the company's sales or marketing business units influence the selection of speakers. That in and of itself has given many companies pause, right? Because a lot of companies, as a matter of at least speaker vetting, will sometimes solicit concept or folks for potential vetting from their sales force, because that is a group of people that's on the ground that has a sense of, who may be good for a presenter, who might have the kind of good presentation skills, be able to kind of control the room, et cetera, be dynamic and interesting to listen to, right? So it's not necessarily per se problematic to utilize your resources, including maybe your sales force, to help inform how you would select speakers. But again, the fraud alert, it kind of draws a line in the sand that has given, I think, some companies pause in terms of how you would navigate that. And then the last one, paying HCP's fair market value, that's as old as compliance is old, right? So I mean, that's one that everyone I think is on board with. There's no issue there generally. 2 other things about the fraud alert, and one is pretty obvious. They call out the idea that we're not just focused on speaker programs. By the way, this could be consulting agreements and consulting arrangements more broadly. The reason that is important when you think about this is that, of course, it's kind of obvious, right? That, of course, there's a lot of potential compliance risk and fraud and abuse risk in a consulting advisory board relationship, et cetera. But when you have to think about your policies, right? So again, alcohol, what's the policy going to be on alcohol availability at your ad boards in terms of maybe dinners that are occurring with the ad board or other consulting type relationships? Are you going to treat that similar to speaker programs, or are you going to go in a different direction? And again, that's just an issue to think about. And the reason I think it's interesting to think about in the context of the fraud alert is the fraud alert is kind of suggesting that any remunerative, any compensation relationship that a pharma or device company has with a physician is, of course, able to create significant fraud abuse risk if things are not maintaining on the rails, right? And again, they're suggesting the presence of alcohol at these meetings is a suspect characteristic. The other one is in-person programs, right? OIG, and this is probably one of the most surprising things from the fraud alert, is that the fraud alert concludes with a suggestion that, hey, in a COVID world, we've all mastered this, right? Like, look at Seth and I doing this presentation right now. Look how good we are at this, right? Like, we've mastered the ability as kind of professionals to communicate with each other and impart educational information to people who need to learn it. And so OIG is saying, look, if you all resume in-person programs, that's going to be another indicator of what's going on with that. Is that a little weird, right? So they don't quite call it out as a suspect characteristic. They do say that the risks with speaker programs will become more pronounced if companies resume in-person speaker programs, right? So the idea of just returning to normal in and of itself creates at least an optic of elevated risk, right? And so that's something also to think about. And I think a lot of compliance officers and other folks that Seth and I talk to all the time are thinking about how can we substantiate the legitimate need to go back in person? Because I do think a lot of people feel very strongly that going back in person is important for reasons relating to imparting educational information. All right.
And I want to build off of that point as we jump into the pharma code changes themselves, which is it's important to take a step back as Brian talks about the differences between in-person and virtual, that the in-person aspect of a speaker program is not the part that's potentially offensive to the OIG fraud alert or to the Department of Justice itself. The content that's provided via speaker programs and other informational presentations, at least as far as DOJ and OIG are concerned, if it's on-label permissible types of information, they could care whether we do it in person, in a fancy restaurant, on the moon. It doesn't really matter where it's conducted. The issues that they're focused on are what's ancillary to the presentation itself. And that's what lends its hand to being potentially a greater risk in person than it would be virtually, which is specifically the two types of potentially illegal inducements that OIG and DOJ are looking at are meals provided to attendees at not just speaker programs, but any type of company event. And two, payments that are going to speakers or presenters at corporate events, particularly speakers programs, but otherwise the traditional basis for the HCP payments. And those are always what are the baseline of where the concerns are coming in that precipitates this special fraud alert and that now has engendered revisions to the pharma code. And it's with that understanding that PhRMA has jumped in and tried to address those provisions in the special fraud alert. And Brian and I are going to separate them out into not necessarily the order in which the pharma code takes them today, but to look at the way we've been handling it more with the sections of the pharma code that are specific to addressing speaker programs first. And then Brian will take on what the pharma code is saying, like the special fraud alert quite at the end, saying that there may be other implications just beyond speaker programs where these same principles would apply. The pharma code is attempting to do the same thing and apply some of these concepts more broadly to other meals and engagements with healthcare professionals outside of the speaker program context. And so when we talk about speaker programs, and frankly, when we're talking about any type of knowledge interaction meeting with a healthcare professional or other individual or entity that's in a position to influence prescriptions or referrals for your products in some way, shape, or form, I think what we take away, and I think what Section 7 here in the Pharma Code takes away, is things that manufacturers have historically taken for granted in terms of we understand the bona fide purpose of a speaker program and the important information it conveys. But getting to the fact that the real issue here comes down with speaker programs to the meals that are provided. If there was no meal provided, having a dinner in a fancy steak restaurant where you're just in the back room with leather chairs and a fancy setting, but no meal or drink being served, does not implicate the anti-kickback statute and is not going to cause risk. The issue that they're focused on is that the meal, if provided, is not only modest, but I think the important part that I want to look at here is incidental to the legitimate bona fide information and content that needs to be provided. And there's two aspects to that as we turn to the next slide. As the PhRMA code lays it out in section 7, it is not just that the information itself is bona fide educational information, but it would be that there is an actual need for the attendees to receive the information that is being portrayed. And that means that is determined on an attendee by attendee basis, meaning that if you're attending 5 of the same type of presentation in the year, the first time it was probably great information. The second time, maybe it was still useful. By the third, fourth, or fifth time, the government is going to be questioning why the individual is there. And the assumption that the PhRMA code is trying to work against is that the individual is there to partake in a meal that is being provided by the manufacturer instead of to take on the content. And the second part to this meal that comes up both now in the PhRMA code revisions as well as the special fraud alert is truly that the meal has to be incidental. And the PhRMA code uses the term that was actually taken from the AdvaMed code of subordinate in focus. The AdvaMed code uses actually the phrasing subordinate in time and focus, but meaning that a half an hour presentation or an hour presentation during a 2-hour dinner is not subordinate in focus. And the government would give the government opportunity for a company complying with the PhRMA code to say that the meal was the primary reason for the event, and the information that was provided was subordinate in focus or subordinate in time or secondary to the meal and the entertainment aspects of the event itself. And that becomes really important. The justification that PhRMA uses that is perfectly legitimate is that in order to get access to HCP's time and attention out of their busy schedules, out of all of the work and patient care that they're providing, it is sometimes necessary to do it over a mealtime as being the most convenient way to be able to do it. But where the meal becomes the purpose of the event rather than just an inducement to hear the information, or rather than ancillary to the event where we can't keep someone captive for 2 hours during dinner or lunchtime without giving them something to eat and drink, that's where the government raises potential issues, and the AdvaMed code guidance now is trying to get at these features.
This concept of incidental, by the way, I mean, this, to me, the revisions to the PhRMA code are kind of like trying to scream this at us, right? Which is the meals need to be truly incidental. If you look, the word incidental, I think, is used 13 times in the revised code. In the previous version of the code, I think it was used twice, right? So this concept of incidental cannot be emphasized enough. It is a common theme throughout the code, across all the provisions that involve the provision of meals.
And again, the goal is the meals do constitute remuneration under the broad scope of the anti-kickback statute. And there is no safe harbor protection for providing a meal to an HCP unless it's actually included in the written services agreement that the HCP is providing, and it's part of the compensation for their services. That's not the case with speaker programs or other arrangements where HCPs are attendees hearing information. And so it's important that the code find a way to protect these benefits that are provided to HCPs. And again, that word incidental is going to be key to making that happen, that it's not the reason for the event, it's just ancillary. the second issue is Brian has already aptly addressed with respect to the fraud alert itself, is the concept of alcohol. And again, as Brian suggested in the special fraud alert, OIG indicated that the presence of alcohol was a suspect characteristic, not illegal, not improper, but suspect, along with the other suspect characteristics. PhRMA has astutely taken a position that, again, if the issue is illegal inducements to HCPs, the inducement is the provision of something for free to the HCP, the meal or the drink itself. And in this instance, PhRMA has taken on the position, therefore, that the manufacturer should not pay for or provide alcohol to any attendees, meaning that there is no remuneration or transfer of value from the manufacturer to the recipient. But keep in mind that because now we saw with the special fraud alert, this was the first time, again, OIG was disagreeing with the PhRMA code as it looked at the prior iteration. And this is another potential area for disagreement, not because the alcohol would still somehow provide inherent value or remuneration, but because it goes back to the question of, is this bona fide necessary education? And is there, if there's a reason for HCPs to be receiving the content, can they adequately be receiving it while drinking alcohol? And that's where reasonable minds can differ. And one drink or two drinks may be different than an open bar with HCPs paying their way for as many drinks as they want. But it does leave open the opportunity for the government to suggest that the bona fide purpose of the education was not appropriate or legitimate if the attendees were having so much to drink that they were unable to pay attention to the information being provided. And this goes with number 5 here on the slide as well, which is the bona fides of the material being presented also goes to the interaction that would be present between the manufacturer and its representatives and the HCPs that are in attendance, which is particularly for an event that is in person, where meals would be provided. One of the understood benefits that PhRMA conveys for having an in-person event where a meal may be incidentally provided is to actually physically interact. Brian and I would much rather be in the room today with the 200 of you and be able to take your questions afterwards in person after this presentation, to get to sit down and do something with you afterwards and get to know each other for those of you who we don't already know. But that's not able to happen on this type of an event through a webinar, and PhRMA recognizes that. But in order to be able to achieve that benefit, the PhRMA code is suggesting that that the company representatives be physically present at the event and not just set up a one-to-one type of speaker program between a paid speaker and attendees with no company interaction, all happening in person, because that risks the potential that OIG or DOJ will view the event as a social interaction between HCPs, and it makes it very hard to audit and monitor the event. And it is intended that the manufacturer representatives are there both to be the voice of reason in the room and to ensure that there are reasonable personal interactions that are happening as a purpose for the live event. Next slide. And again, these I'm not going to harp on a whole lot in terms of the provisions of the new PhRMA code. But again, this is something that OIG, as Brian indicated, did really harp on, is that, again, repeated attendance at these events, guests, anyone who doesn't need to be taking in the information that's being provided shouldn't be there. And if they are there and a meal or drinks are provided, those are indicia that the meal or drink may be the purpose instead of the ancillary focus of the event itself. Next slide.
Yeah, and just one point I want to make. I actually want to go back one slide for a second here on this whole idea of incidental, because I think companies are struggling with this, which is like the locations for your speaker programs if you go back in person. And consistent with this concept of incidental, the PhRMA code makes it clear that the restaurant should not be the main attraction of the event or perceived as such, right? And I think what that's trying to get at is that I think in practice over time, what this devolves into, or considerably, or maybe has devolved into, is people are very focused on where is this meal going to happen, right? And they're excited to go to the speaker program not because they want to hear the information, but because of the restaurant itself. Even though we're going to be under our 125 limit or whatever you've set it at. But the important point here, and this is an important one because it's a change in terms of how people typically think of restaurants per current industry standard, is that you got to be careful that the restaurant is not the main draw. You could still be within your meal limits, but be kind of inappropriately selecting a restaurant because it becomes the primary reason that people want to go.
Yeah, and one other thing I'll just add to that, and then let's open up the second polling question is, we have a slide and we'll talk a little bit more about the difference again between in-person and virtual. But with regard to virtual meals at virtual speaker events, this also becomes really important, which is from a compliance perspective, if you're providing a meal virtually to a virtual attendee for their participation from a remote location, presumably in their office or their home, the question also then becomes is what's really being provided, and are they going to be eating the meal during the event, or is it something that's going to come or be delivered after the event, before the event, that they put in the refrigerator and heat up later, that they take home with them after the event? Any of those types of things would be indicia that the meal was not incidental to the event and was a value add or something in addition to the information that was being provided. And so while neither the PhRMA code nor the OIG special fraud alert expressly prohibit the use of meals as incidental to virtual events as well, there are a host of compliance issues that will come up, and we will talk about them more this afternoon with respect to providing virtual meals. With that, let's open up the second polling question. Has your company modified its speaker programs since the publication of the OIG special fraud alert or the updated PhRMA code? And in this question, as you check the boxes, please, we're asking to check all that apply in this instance, not just one answer, as there may be a number of things that your company is doing. Give everyone a moment to respond.
Do you want to take some questions now, Seth? Because there's some questions around meals and speaker program.
Sure.
When should we keep them for the end?
I think we're glad to address them, Mohammed.
Okay, let's take a couple now because there's way too many. I think we'll probably all the time. But I think the first question is it safe to say that because of the speaker program's new exclusion of alcohol, that any company-sponsored dinner with HCPs should now exclude alcohol?
And so first, we want to be real careful with the language with this, which is the PhRMA code does not exclude alcohol. The PhRMA code provisions only prohibit the manufacturer from providing or paying for the alcohol. So one can be compliant with the PhRMA code, excuse me, if the HCP in attendance brings or purchases their own alcohol for the event, such as paying a separate tab, going up to the bar, getting their own drink, and bringing it over. What Brian and I are suggesting is that isn't entirely coherent and consistent with the special fraud alert guidance, but the special fraud alert guidance only indicates that alcohol is a suspect characteristic and not in and of itself necessarily inappropriate. And that's where PhRMA has come down. And so companies will have to make the decision whether the presence of alcohol at any type of meeting or event undermines the legitimate need and business purpose for the event, making it such that the attendee can be receptive to the information that the manufacturer is trying to convey, to which the meal and drink are incidental. If that's okay and they're having a glass of wine and the company believes that that's appropriate, then it wouldn't be prohibited by the PhRMA code. The context, though, will matter, and it's the type of thing that could come up in future investigations as to the level of drinking that occurred at events, and therefore whether the information being conveyed was in an appropriate environment.
And there is definitely a different level of risk associated with alcohol at like a consulting type arrangement or an ad board versus alcohol at a speaker program, simply because of the fraud alert focusing on speaker programs and the changes to the PhRMA code, right? So the fact that there were not specific mentions in other contexts affects the risk profile. But this goes back to, you know, something I said earlier, which is this is more about just the integrity of your interactions, right? If you look at the fraud alert, if you look at the changes to the PhRMA code, what they are really kind of tacking to is this a legitimate interaction or is it not, right? And so there should be a way to where you could have a legitimate interaction that could be defended if you ever had to defend it, and have alcohol be present, right? But there's a big difference between somebody having a glass of wine or a beer versus, you know, champagne flowing all night long, right? So you just kind of have to think about all that. But I think these questions are good. This question is good because that's the kind of stuff that you practically have to walk through and understand and think about how your own inconsistencies might be used against you. We could talk about this for another 20 minutes, right? I wish we had the time.
And that's what I was wondering, whether we should take more questions. I'll take one more and then we can go back to the flow of the webinar. The question is, thoughts on conducting speaker program at a conference like Las Vegas, where the location is at a resort or a casino. Is it inconsistent with the PhRMA guidance to host a speaker program to leverage the, I guess, existing Congress attendees at a modest restaurant located within the resort and casino?
Brian, you want to start with that one?
Sure. So I would say this. I don't know that you would apply your standard policies any differently to that scenario, right? Which is, if there's going to be a well-respected, nationally renowned conference for HCPs, it's going to happen in Vegas, per the example, and you want to have a speaker program in conjunction with that, I think you would select the location for that based upon how you would select the location if you were operating in Vegas generally, which I'm sure many of you have operations in Vegas, right? So I don't know if there's a special exception for that. Now, if you're talking about something like a product theater, which a lot of these conferences have as part of the agenda, the option to kind of purchase space to do like a speaker program like activity, as long as I think you were participating in that kind of reputable Congress and purchasing that space, you know, in association with that, then the risk should be acceptable, right? I mean, because your defense would be, this is where the conference is located. We purchased the space for the room to have this program. But I think you want to be careful, because just because the conference is in Vegas doesn't mean you've got carte blanche to kind of have everything at the Bellagio or something like that, right? I think you want to apply your typical policies and procedures.
Agreed. And the simple answer there, I think, is a venue that is convenient and conducive to the information that needs to be conveyed is always likely to be defensible, and a location that is of itself the draw or reason for joining is more likely to be challenged. And, you know, where that line is going to differ for each company, and you're going to have to make those decisions as you move forward. With respect to the polling answers here, and let's jump back into the presentation, I think these answers should be instructive to all of you, and I think it is about what we expected at this point. Remember that the PhRMA code updates don't actually go into effect until January 1, 2022. And so for those companies that haven't made changes to any of their policies or procedures yet, some of you may already have policies and procedures that are consistent with today's latest PhRMA code iterations, and others of you may need over the coming months to think about making revisions or adjustments to your policies and procedures to comply with the PhRMA code. And again, whether or not you are one of the companies that voluntarily publicly state that they comply, you may need to make these changes to ensure that you comport with state law requirements, as we'll talk about in a few moments. It's also interesting to see that, as we have been seeing and expect, that companies are treating things like alcohol, the provision of alcohol, a little bit differently given the leeway under the PhRMA code, with some companies not ensuring that no alcohol is available, period, and others just ensuring that they're not paying for or providing it. But where most companies are focused on changes to their policies or procedures relate to the issue of alcohol and tracking of HCP attendance to make sure that we don't have individual HCPs who are frequent flyers at particular speaker program types of conferences. Brian, you want to jump into the meals?
Yeah, thank you, Seth. So the other thing we want to talk about, which is probably, and some people argue they think it's the biggest change to the PhRMA code, is a change that's been now added to section 2, which is the section on informational programs with meals, typically meals that your reps are having kind of in the regular course of their activities day to day. And so this section is largely the same, with the exception of the information we have on slide 23 here. One other plug I want to make for the term incidental. So not only is incidental used in the provision that we're focused on, but it's also one of the only changes. If you look into paragraph 2, which we've got on the right-hand side of the slide here, they've inserted the word. Now it says it's appropriate for occasional incidental meals. The previous version of the code said occasional meals, right? So incidental, again, we're getting hit over the head with the concept of incidental. And I think that the change that they've added that we're going to focus on now, which is on this slide, is reiterating this concept of what the true purpose of the meal is supposed to be, as Seth described it earlier, right? The meal, the justification for the meal is to facilitate the legitimate educational interaction. And so if you have a situation where your reps are going in and people are receiving meals, yet they did not participate in that interaction, that just looks like a gift that you gave to whoever would have received that meal. Now, interestingly, the code has always generally suggested, section 2 has always generally suggested that you should be providing meals to folks who attend the presentation, right? So it's always been, I think, relatively the signal from the code that, of course, anyone who's receiving the meal needs to be hearing and participating in the presentation. So the change that they have included here is like a real strong recognition, I think, of maybe how things have been devolving over time in the field, right? Which is what I think happens in some cases in the field is you've got reps going in, and if you think about COVID in particular as well with virtual meals, right, where it's even that much harder to confirm that whoever would have participated in your presentation received the meal, actually participated in the presentation. There is a real focus now that I think may even require some type of operational changes for some companies, or policy changes, procedure changes, because the code now says the meals that your reps are providing, right, most practically, that there should be a reasonable expectation and reasonable steps are taken to confirm. Reasonable steps are taken to confirm, right? Like that suggests something needs to be done to confirm that each attendee has a substantive interaction or discussion with the company representative, right? So that's going to be one that I think everyone, if you're not focused on it yet and you've kind of put it aside, I would not push it aside, right? I think this is a very important change to the code. And again, from some of the discussions we've had, there are some compliance officers who believe this is the most important change to the code, because the fraud alert stuff and the speaker program stuff, we got that signal in Novartis of 20, June of 20, right? So this is a change that I think is going to require some operational consideration, right? And to me, it's a little bit of like, because obviously PhRMA is the industry association. This is a self-regulating code. So that to me suggests that there was enough of a concern around this issue that they needed to emphasize it in the way that's emphasized in the current code. And so this is one where, again, who knows what will happen from the future of this, whether there could be increased potential enforcement action relating to rep meals, especially with the world of open payments, et cetera. But I would urge all of you, and again, I want to be mindful of time, but the larger point here is don't sleep on this provision and think about ways that you can actually take steps to, quote, confirm that people are having a substantive interaction. The FAQs that we've got on these following slides are just FAQs that breathe a little bit more life into that provision, where they're just kind of suggesting what it means in practice, right? Which is, again, this concept of reiterating the idea that folks need to be having an actual substantive interaction when they receive a meal. All right, so now our third and final polling question. Does your company plan to make policy changes regarding reps in-office HCP interactions based on updates to Section 2 of the code? So this kind of gets at, again, the point I was just making around the signaling in the code of this idea of reasonable steps to confirm, suggesting that if you ever had to defend your compliance with the code, you'd need to be able to present whoever was questioning you with, here are the reasonable steps we take to confirm, and whether people are kind of thinking about changes to that.
And Brian, there's a question related to that while people do the polling. The question is, I understand that the focus is on speaker program, but how does the new code implicate in-office meals, given that this is still a meal and transfer of value? I think you covered that, but I think if you want to maybe explain a little bit.
Yeah, and so this is an important point, right? So as Seth said earlier, so we're walking through the changes to the code comprehensively. So we did just shift gears, right, from Section 7, which is speaker programs, to Section 2. Section 2 of the code is entirely focused on informational presentations that reps are having kind of in the regular course of business. So Section 2 itself, just the context of it, is essentially, reps going in and detailing physicians.
Okay, I'm going to share the results for the poll.
And it does look like the predominant response, and I generally agree with this, which is yes, we will enhance monitoring and auditing efforts. And the reason I think that's important is that is, I think, at least at the interim, or at least in this kind of, as we're thinking about the future, it's a way that it does require some lift, but it's not yet going to require some other kind of piece of information to be developed or something like that, right? Other things that, I've just kind of thought about thinking through this is, would you require reps to somehow confirm that there was a substantive interaction with everybody that received a meal through some checking the box in Viva or some other whatever CRM system you're using, et cetera, things like that. But I do think, what we're seeing in the poll is kind of consistent with what I would expect to see.
I would think,
okay,
Brian,
and just real quick. Yep.
Yeah, just on your point around a rep noting, I think maybe at some level, there could be a flag or something that says whether alcohol was made available or not, perhaps in Viva or something. That might also allow later to look at the data and see which events had it and which didn't. But I'm going to hide the polling result and we can go back to the presentation.
Yep. Just a couple other quick things. I know we're pretty much at the top of the hour here, right? So the changes to consultants, Section 6 code, it's just focusing again on this idea of high-level, high-end restaurants, making sure that the venue and the meal are kind of incidental and subordinate in time and focus to the actual purpose of the interaction. So not surprising that that would follow through into consultants. And then with respect to third-party events, there's just a clarification regarding the applicability of those provisions to virtual events. Nothing too groundbreaking. I think the most notable thing, and there's been a lot of things written about this, was the absence of more direct provisions regarding virtual activities. I think there was, some people were expecting there to be provisions that specifically address virtual meals, for example. And so we don't have that yet. That was not in the PhRMA code. These 2 points here on this slide 28 are the closest that they come to actually addressing the virtual world.
So quickly, I wanted to then just touch on what we see overall. There's a need, as I think you see from the polling questions and our discussion of the key changes under the PhRMA code, that there's probably a need for most companies to go back and relook at policies, procedures, and think about updating policies, procedures, and auditing and monitoring as well, to make sure that effective at least January 1, that you're going to be compliant going forward with the new PhRMA code provisions. In addition, we've called these out throughout today's presentation, but really want to harp on the fact that there are, previous slide, Brian, that there are two main differences between the special fraud alert and the new PhRMA guidance itself. And these are areas where the special fraud alert of OIG particularly calls out suspect characteristics that are addressed but not completely overridden by the PhRMA code provisions. And that being, again, the availability at all of alcohol is a suspect characteristic under the fraud alert. The PhRMA code only prohibits manufacturers from providing or paying for alcohol. So that's one substantive difference that leaves open vulnerabilities for companies complying with the PhRMA code. And the second relates to the selection of speakers, where PhRMA has recognized the importance that marketing and sales can play in knowing who your HCPs are, what their qualifications and capabilities are, and allowing them to have input into the selection process for who can be a speaker, whereas the OIG guidance suggests that that in and of itself is a suspect characteristic. Won't dwell on those. The next slide is something, again, we've touched on several times, but want to make sure that you all walk away with the understanding of, is that specifically there are a number of states, California, Connecticut, the District of Columbia, Massachusetts, and Nevada, that all to some degree incorporate compliance with the PhRMA code or the AdvaMed code as a means for compliance with the state laws themselves. Accordingly, you have to have a measure going into next year to make sure that when you are going to certify to compliance with these states, and states like California and Nevada have annual compliance certifications, that you are making the necessary updates or that your policies and procedures are already compliant with the new PhRMA code provisions.
And some of these states, by the way, and this is interesting, it's a state-by-state analysis, but there have been companies that have put forth the concept, what if we don't want to adopt the updated code? What does that mean from the vis-a-vis these states? And if you look at these states, I'm not going to go through each one, but they have different requirements as to whether you're required to adopt the most recent version of the code. So for example, Connecticut requires adopting of the version of the code that existed in January of 2010. That's what the statute says. Adopt as it existed in January of 2010. Other states will make it clear that the expectation is that you adopt and comply with whatever the most recent version is, or as it's updated, right? So if you're thinking about kind of parsing this through and not fully adopting the code and want to think about your discretion, you're going to have to go through that analysis. All right, just very briefly on key takeaways and next steps, right? So the unanswered kind of questions around enforcement are, what is this going to mean from an enforcement perspective going forward? Really, these are the kinds of questions that I think a lot of folks have been asking since the fraud alert came out. in November of last year. But we're still kind of waiting for the other shoe to drop, so to speak, on all these things, right? Like, are we going to see increased whistleblower activity, right? Like, are you going to be at risk as an industry if you have alcohol available even though you don't pay for it, because some whistleblower might try to file a key tam, right? Like that kind of stuff that could play out, right? The other thing that could play out, and we've seen this play out with some of the enforcement work that we do, is because the code has been updated, and as Seth said earlier, oftentimes the enforcement that we see 5 years from now is going to be things that are happening now, right? And so in some cases, you might have the Department of Justice looking at you 5 years from now and then using, a current version of the code, even though the activities that were occurring in 2019, 2018, where alcohol would not have been so strongly prohibited, but they try to kind of retroactively apply that standard and suggest that your activities in 2018, for example, would have been nefarious because alcohol was available. Again, we don't know if that's going to happen. We have seen inklings of that based on our work historically when there have been revisions to the code and changes in that respect. And then finally, and hopefully you've kind of gleaned this throughout our presentation, right, is that of course you're going to have to make updates to your policies and procedures if you're going to comply with the most recent version of code by January 1, 2022. We hope that we've kind of given you food for thought through today's presentation about what those policies might look like, or the kinds of things you at least need to be thinking about with your colleagues as you go between now and the end of the year to make any updates that you think are necessary. And with that, we are a little over, but again, yeah.
We'll turn it back to Mohammed, but these slides will be available to attendees after the presentation. So if you had questions about something that we jumped through quickly, you will be able to have a copy of the slides.
And Brian and Seth, if you can stay for a few more minutes, I do want to make a quick announcement of something that's exciting that we're releasing for the industry here in the next month. And then I do want to answer a couple more questions. While I guess we're a little late, we can stay a little bit longer. This is just a quick introduction to Core Data. We provide the complete compliance software solution suite, including transparency reporting, compliance monitoring, HCP engagement. But what I'm really excited about is our launch of this new product that's going to come out in a month. And as a thank you for the folks that are attending the webinar today, it's basically, it allows you to risk score for your speaker programs at scale. So the 7 provisions that we saw in the OIG fraud alert and the updated PhRMA codes are all catered via software. So if you're interested in just seeing a quick pre-release demo, it's going to be available to the public end of October. But for this webinar attendees, just drop us a note at marketing@CoreData or text me at 609-608-2316 or type risk scoring in the chat box and we'll follow up. And some of these provisions are quite tricky, right? So when we talk about repeat attendees, what does that mean? What's that length of time? What's the content criteria that makes it a different content, right? So there's things in there that are really interesting, and we've tried to solve this so that it can be solved once and for all. So you can run through all of your speaker program data and be able to risk score for speakers as well as specific events. So just wanted to give you that option, and I'm going to come back to questions. I'll take 2 more, not to take the entire day here. So the first question, I guess a couple of people have asked around like the selection of speakers. I guess the 2 questions that I can read out, should senior sales leaders be prohibited from submitting nomination for speakers? And I think a similar question came in, which was if sales and marketing should not influence speaker selection, who does that leave but medical, and why would it be appropriate for medical to pick the HCPs to serve as a promotional speaker? So if you can tackle that.
Sure. So again, the issue that's being tackled here by PhRMA is the inference by OIG that, again, when we talk about the two types of payment or remuneration that can come through speaker programs, the meals and the payments to the HCPs, the opportunity to earn payments as a speaker is a form of payment that implicates the anti-kickback statute. And under the law of many jurisdictions, to the extent that one purpose of the selection of the speaker allows them to get payment and is in return for their future prescriptions of your product, the broad scope of the anti-kickback statute has been implicated, and it is a criminal law. And that's what OIG is suggesting, that where sales and marketing may be involved in that selection process, whether it be someone at the senior level or a field personnel, that there could at least be a perception that one purpose of the selection is because they're a good customer or a future good customer, as opposed to, I think the reason PhRMA aptly has pushed back against that suspect characteristic and does allow sales and marketing personnel to be involved in the influencing the decision making, is to the point of the question that pharma companies understand that those are often the people who have the closest contact and knowledge with the potential speaker to know whether they're a good presenter, to know how they would be in public, to know whether they're likely to want to do something like this, to know who has the expertise. On the flip side, anyone from medical, R&D, clinical areas, and MSL may also have interactions with these types of HCPs who would serve as speakers, and could also potentially determine whether they would be effective promotional communicators and know and are aware of the subject matter of the drug or device at issue. And so there are other opportunities in most companies to be able to focus the selection process on them. And there are also types of things that companies do, such as companies that offer grants to healthcare professionals and institutions that allow sales and marketing to have some impact in the process of nomination and input, but where somebody other than sales and marketing is making the final determinations based on all levels of input, not just the ability potentially to sell to the individual HCP who would be paid. So there are a lot of different options out there for companies, depending upon their risk tolerance, depending upon their size, depending upon the composition of their personnel. But in few cases, does it likely have to only be sales or marketing personnel making those decisions?
Okay.
I just have two things to add to this, right? One would be, I think as you get closer to the ground, the closer that you get to field sales, your risks will go up, just optically, right? Those people are going to be motivated by scripts written by individual people that will infect their incentive comp. And so the closer you get to the ground, the higher the risk, at least optically. The other thing I would say, everything that Seth is saying, like, it's thinking about why are they involved? Like, what is the reason they're involved? And if you can articulate a reason for their involvement that is not focused on value or volume or benefit to the company and focusing more on their ability to be a legitimate, effective speaker, that's helpful, right? So it's, and I think that's what PhRMA is getting at really, is what's the underlying purpose for making the selection and not focusing so much on who's making this selection.
Okay, I think that's comprehensive. I guess I'll take just one more, and this should be a quick one. Does a company with nutrition products that are not covered by federal or state programs have risk for the issues in this broadcast? We voluntarily follow the PhRMA code is what the, I guess, attendee is asking.
I guess I have two reactions to that, and I'll start, Seth. One is, I think, generally speaking, the PhRMA code is, I think, directly applicable to prescription drug manufacturers, right? So to the extent that you're not engaged in the manufacturing, marketing, distribution, selling of prescription drugs, there would be at least, I think, a reasonable basis as to why you wouldn't be complying with the PhRMA code. But the broader question, right, is like, what's your risk more generally under the federal anti-kickback statute which is one of the principal reasons we have the PhRMA code and why you'd want to comply with the PhRMA code, right? And that's going to be focused on, are you marketing and selling products for which there's government healthcare program reimbursement available, right? So is there Medicare, Medicaid, et cetera, reimbursement available? If there is reimbursement available for your products, then you would want to think very carefully about whether there would be a real benefit of complying with an industry standard like the PhRMA code, because I think, as we've suggested throughout this presentation, enforcement authorities will look at the PhRMA code as kind of a baseline of ethical interactions with healthcare professionals to some degree.
Okay, I think that covers, I mean, we do have several additional questions, but I think what I'll do is I'll compile them and maybe we can send them over an email if that works for you, Seth and Brian. And I guess with that, I'd like to thank everyone for showing up today. It's been a great hosting Seth and Brian, and it's been great to have so many people attend through the webinar. So hopefully this was able to provide you the value you were looking for. If there's any questions, feel free to reach out to us directly. We're happy to share contact information of Seth and Brian as well, and you can reach out to them as well. Thank you so much for attending. Thank you, Seth and Brian, for amazing content and all the valuable information that you provided today. Thank you, everyone. Bye-bye.